Hello and welcome to the East Meets West podcast. I'm your host, Dr. David Cherian, and this is the podcast where we talk about health and medicine from both an Eastern perspective, especially looking at Chinese medicine, as well as looking at health and disease topics from a Western medicine perspective and what traditional allopathic medicine has to show us. And for today's episode, I thought we would talk about gallstone disease. And gallstone disease is very common, and we'll look at some of the numbers for it and also just differentiate what some of the complications are of it and what the typical symptoms are and how treatment typically proceeds from both a Western medicine perspective as well as an Eastern medicine perspective. Now, to just give a big picture overview, when we talk about gallstones, it's important to have a baseline understanding of what the anatomy is like. So, typically on your right side, in the upper part of the abdomen, you have your liver, and your liver connects to your intestines via a tube called the bile duct. And it actually drains the bile from the body into the intestines, and that's one of the way it expels it from the body. Now, connected to the bile duct is the gallbladder. And the gallbladder is one of the places where bile is stored and so that it can be released at the appropriate time. Now, that bile usually sits in the gallbladder and it gets released, but over time, you can have accumulations of what we call gallstones. And that's what we're talking about when we have gallstones. It's actually small stones that are sitting inside the gallbladder. Now, for a lot of people, that doesn't cause any problems. They may have had it there for years, they never notice anything, never feel anything. But for a percentage of people, it can cause pain symptoms, and that's what we're going to look at today. So, to just talk a little bit about the statistics, gallstones are pretty common. In the US, it's estimated that 6% of men and 9% of women have gallstones. So, it's fairly common, and it could be asymptomatic or you could have symptoms. A lot of people have gallstones, but they don't feel anything. And in fact, probably the majority of people who do have gallstones are what we would call asymptomatic gallstones. And a lot of times they find it out because they were going for testing for something else. They get an ultrasound or they get a CAT scan or something else, and then they find out that they had gallstones, but they never actually felt anything. Now, some people will have symptoms, and we typically call the symptoms of gallstones biliary colic. So the typical symptoms of biliary colic is, well, first of all, even though the name is colic, biliary colic, it tends to be more of a constant pain, not a transient, quick, colicky type of pain. It tends to be a little bit more lasting. But typically, people who have biliary colic, they feel kind of an intense, dull pain, mainly in the right side and the upper part of their abdomen, a little bit below the rib cage or underneath the lower part of the rib cage on the right side. That's where the gallbladder is, and so that's where typically the pain is, although it could be in other areas, but that's the classic place. Some people may have pain that shoots to the back, like the right shoulder blade, and you might also have sweating or nausea, vomiting. Those are all some of the qualities of the type of pain you feel. Now, in addition to that, one of the other ways you can tell whether it's biliary colic is if there's any association with eating. So one of the one of the things that you'll notice with biliary colic is that it can be triggered on by uh, a heavy, greasy fatty type of meal. So if you have a big plate of fried chicken and then 30 minutes later you're starting to feel this pain in the right upper side, that may be biliary colic, and it may be your gallbladder that's feeling stressed after all that big heavy meal. And so it does, like I said, it does last for a little bit longer. It's not like a quick comes and goes sharp thing over in a minute or two. It tends to kind of build up for about 30 minutes and then peaks at an hour. And it usually ends in about the entire attack can will end in about less than 6 hours. It shouldn't go past that, although sometimes it can. And we're not 100% sure why the pain occurs, but it's thought that the gallbladder is contracting and squeezing the stones that are in there, and then those stones go up and push against the opening of the gallbladder duct, and it can block it, and then that causes the pain. And it kind of makes sense because typically when you eat a heavy meal, it causes your body to release some of the bile, and so it's triggered by the same things that you would expect after eating a heavy meal. But we're not 100% sure, but we that does seem to be what typically happens that causes that type of pain. Now, you can have complications of gallstones, but if it's just biliary colic, meaning the stones are just in the gallbladder, they're not actually causing any problem, you're not going to see other symptoms. Like usually your blood work should be okay. If the doctor checks your liver enzymes, it should be okay. The pain is typically not severe enough that you need to go to the emergency room. If it does feel like that, then something else may be going on and you should consider going if you feel that severe. And typically, um, the exam that a doctor does with your abdomen, there's not going to be anything too specific that they'll be able to find. Sometimes you will feel the pain right in that area, and they may notice that. Once you do have an episode of biliary colic, it's highly probable that it would happen again at some point, although there's no way to really predict. Some people have it within another few days. Some people might not have it again for months or years. Really hard to predict, but chances are, if you have gallstones, if it causes you a problem, it might happen again in the future. One common thing that we do see a bit at the hospital is gallstones and chest pain often getting mixed up. Sometimes it can be hard to tell the two apart. It can be hard if you're just a regular layperson without medical training, and it's difficult for doctors a lot of times to tell the difference between a gallstone that might be causing your pain versus a heart or cardiac problem. So those two do get intermingled sometimes, and the only real way to find out is to do more testing. And then honestly, sometimes even after a lot of testing, it's still hard to differentiate which one might have been causing your symptoms. There are a few complications of gallstones that are important to know about. Um, and I'll just go through a few of them here really quick. One of the main complications of having gallstones is you could have what's called cholecystitis, which means inflammation of the gallbladder, and it's usually related with gallstones. Sometimes, if the gallstones just different people, they can develop an inflammatory response and even an infection. And in those situations, the pain is going to get even worse on that right side. We usually see people develop fevers. They may have abnormal white blood cells. Typically, in those situations, you're going to need to come to the hospital. Um, and we typically use antibiotics, surgery, or a combination to treat that. And that is a common condition. And usually in those situations, you'll end up getting gallbladder surgery. But it just depends on your particular situation and your doctor's recommendations. So cholecystitis is a common complication. The second complication of gallstones is sometimes stones in the gallbladder can actually come out of the gallbladder, and they go down into the tube, like I said, that connects the liver to the intestine. And when they go into that tube, they can get stuck there and they can block that tube. And so what ends up happening is the bile that the liver's supposed to be draining out ends up getting blocked, and the tube gets blocked, and you have what we call cholelithiasis. And it's basically a big word that means stone in the bile duct. And that itself will cause the blood test to show inflammation in the liver. Your liver enzymes will shoot up. And then it can subsequently become infected as well. Again, just like the gallbladder can become infected, so you can have an infection in the biliary tubes, and you'll have fever. You may develop jaundice, because the tube is getting blocked and the bilirubin goes up. And so that's also something that's going to have to be treated fairly quickly in a hospital setting. And then the third complication that I'll briefly mention here is what we call gallstone pancreatitis. So again, the stone comes out of the tube and it migrates downward, and then it actually blocks a second opening that connects to that tube, which is where the pancreas connects to. And when the pancreas gets blocked, then you have a pancreatitis, or inflammation of the pancreas. And that is also very painful. And that is also something that you would need to come into the hospital to get checked out for. And typically, doctors can diagnose it by looking at the blood work of your liver and then also checking blood work on your pancreas. So, cholecystitis, cholelithiasis, and then gallstone pancreatitis. Those are three of the common complications of gallstones when they do cause problems. We talked a little bit about it, but I'll go through it in a little more detail here. Typically, when it comes to diagnosing gallstones and biliary colic, it's largely the history that a patient will give, and if the doctor feels like the history is consistent with biliary colic and gallstones. And then the key thing is also an abdominal ultrasound to look and find stones in the gallbladder. So, like I said, if a patient comes in and you have the typical signs where there's pain on the right side, you have pain after eating, heavy meals, greasy meals make it worse. It lasts for 30 minutes to a few hours, and it's been recurrent. That's a pretty good indication that there's gallstones there. Now, your doctor is going to want to make sure that your liver tests are normal, that your pancreas tests are normal, just to make sure there's nothing else that may be causing that. And if so, then they're also going to want to do an ultrasound. And the ultrasound is going to visually see the gallstones. And being able to see the gallstones visually and having the symptoms helps to give you the diagnosis of biliary colic, gallstone disease. Now, ultrasound is typically the best method to identify gallstones. Sometimes you can see them on CAT scans, but it's usually not as good. Even on x-rays, it's typically not as well seen. So your best chance of seeing the gallstones is using an ultrasound. So you want to do the right test also to identify it. The type of ultrasound, they usually just do it right over the abdomen. That's the easiest way to look at the gallbladder. You don't have to get any anesthesia. It's not as expensive. There are other methods that can be done, but typically what we call a transabdominal, or just over the abdomen ultrasound, is enough to be able to find and see the gallstones. If you have an ultrasound and they didn't see any gallbladders, it's not 100%. Sometimes your doctor may want you to get a second ultrasound after a few weeks to reevaluate it and see if maybe there was a stone in a position that couldn't be seen. It doesn't capture all of them 100%, but it is a good and reasonable test to find most patients who have gallstones. There are other things that can cause similar symptoms. One of them is gastroesophageal reflux disease, and we have done a whole separate episode on gastroesophageal reflux disease. So if that's something you're concerned about, you may want to check that out as well. But like I said, there's a number of different things that can cause similar symptoms. So it is important for you to work individually with your doctor to sort through all of those possibilities. So statistically, to get an idea of how much at risk you are, the majority of people with gallstones are asymptomatic and they just don't have any problems throughout their whole life. Now, out of those who were asymptomatic, about 15% to 25%, so almost a quarter of people will at some point develop symptoms. And that's just symptoms. From that, a smaller percent will actually go on to have actual complications that need treatment or need surgery. So the vast majority of people with gallstones will probably not feel or notice anything their whole life from the gallstone itself. As far as treatment goes from a Western medical standpoint, usually when we have patients with gallstone disease who are having pain from it, who actually have biliary colic, it becomes a very individualized decision on whether you should undergo any sort of treatment for it. The typical plan of care, if you have symptoms from gallstones, is with the first episode of biliary colic, you can choose to wait and watch, or you can choose to go for surgery. It doesn't have to be an emergent surgery. Usually, you can have time to schedule an appointment with the surgeon, talk with them, see what they think, and be in a good place where you can do it at a time that is good for you and they can get you scheduled. That's if you have one episode of biliary colic. If you just have gallstones and you never had any pain, never had anything, then really you probably don't want to go through that. You might want to just watch and just live your life until anything comes up. Because, like I said earlier, the majority of people who have gallstones are never going to have a pain or any problems from it per se. But if you do have biliary colic and you do have symptoms from it, then at that point you can consider getting treatment with surgery. So, depending on your preferences and your doctor, after you have an episode of biliary colic, they may decide to just wait and watch, see if it can, if you have any more episodes, see if you can avoid surgery. In some scenarios, they may recommend that you go ahead and just have surgery. And if you choose not to have surgery, it is important for you to still know what the symptoms are if it happens again, or if you were to have any complications. And that's really one of the main reasons why that they would consider doing surgery even after a first episode. If you have one episode, there's a higher chance that you could have either have it again or have complications. And so therefore, in an effort to prevent that, that's kind of the rationale for doing surgery after a single episode. So that's an individualized decision that you'd want to make with your surgeon. But that doing surgery and removing the gallbladder tends to be the definitive treatment. There are medication. There's not a lot of medications, but there is one other medication some in some scenarios that's used called ursodiol, and it's a medicine that is intended to try and dissolve the stones. Now, one of the problems with it is that it typically works ideally for stones that are very small, and you should have an otherwise normal, healthy, functioning gallbladder, and it takes a very long time to dissolve. Sometimes patients might need to be on this medication for years because it dissolves the stones at a very slow rate. And during that time, you're still at risk and you will still need to get ultrasounds to follow up. And so it's a longer course. It's not the preferred mode of treatment, but it is an option as well, and something that you could consider talking to your doctor about if doing a surgery is something that you want to avoid at all costs. Now, that was a lot of the Western medicine aspect of treating gallstones, but I also wanted to talk about gallstones from an Eastern medicine's perspective and how we view gallstones in Chinese medicine. I think the first thing that's really important to understand is there's not really a word of gallstones in Chinese medicine. It's not a diagnosis that we typically, it's not a term that we typically use in diagnosis. In Chinese medicine, when we talk about gallbladder, some of the common things that can happen to the gallbladder is heat. You can have heat in the gallbladder. You can have phlegm accumulate or dampness accumulate in the gallbladder. And that can be very similar to what you would see in Western medicine, biliary colic or gallstone disease, but they're not necessarily identical. And so it's important in Chinese medicine that you classify the disease based on the Chinese medicine categorization scheme. And I wanted to talk about one formula that is related to gallbladder disorders and in certain types of cases could be used if you do have gallstones, but not necessarily always. And that formula is a formula called Wen Dan Tong, Wen Dan Tong, or warm the gallbladder formula. Warm the gallbladder formula. And this was a famous formula. It was developed around the 1100s AD, and it's been used for a long time with a lot of success, as long as you understand the cases in which it's supposed to be used for. Now, Wendan Tong is, even though it's called warm the gallbladder formula, it's actually somewhat ironically a little bit more of a cool formula, and it helps actually to properly disperse the heat, because what happens in Chinese medicine in oftentimes in gallbladder disease is what can happen is the pathogen can become constrained in the gallbladder. And when the pathogen becomes constrained, it starts producing heat, and the heat causes symptoms. And it can cause a variety of symptoms. So, actually, in Chinese medicine, you could have a gallbladder type case, and even though you may not have pain in your right side, you might have other symptoms. You might feel irritable, you might feel warm, you might have a lot of hunger. It could cause you to have palpitations, it can cause you to have anxiety, difficulty with sleep. And from a Western medicine perspective, we don't necessarily see those things as, like a gallbladder problem. But in a Chinese medicine perspective, those things can all be tied together as part of a gallbladder disorder. And so Wendan Tong is a formula that helps to open up and release heat that has been constrained in the gallbladder. Some of the main, probably the main herb in Wendan Tong is an herb called Ban Xia. And this is an herb that is used to transform phlegm. And in Western medicine, we talk about phlegm as kind of this thing that you cough up, you expectorate from your lungs, and it's thick and nasty. But in Chinese medicine, phlegm is not just that. It could be located in other parts of your body, and it's basically thinking of a sticky substance that that accumulates in places that it shouldn't, and it can cause problems once it accumulates. So the main herb in this formula, Wen Dan Tong, is called Ban Sha, and the primary use of Ban Sha is to transform and eliminate the phlegm. So you could kind of think of it like gallstones being a form of phlegm. And although I would be cautious to always use that type of analogy. It's a simple way to kind of grasp the idea. And so this is a formula that helps to transform phlegm, transform and break it up, get it out of the body. And at the same time, it helps to support the spleen and the stomach, because a lot of times when the gallbladder has difficulties in Chinese medicine, it can overreact against the spleen and the stomach. Typically, a doctor is going to see other signs of phlegm in the body. So when we look at your tongue, you might have thick yellow type coating. You might have a rapid pulse. It might be type slightly wiry. Those are other symptoms that we might see in a Wen Dan Tong type case. So that's one example of a formula that may be used for your situation if you have gallstones. But like I've said before on this podcast, every situation is different. And even if you have a Wen Dan Tong type case, it's going to, a good doctor is going to be able to still modify the formula as necessary for your particular condition. And so you always need to look at the underlying presentation, the individual person who's coming and what their body type is like, what other problems they may have health wise, and then delineate the problem and determine your treatment. So, from a Chinese medicine perspective, there are good options if you are interested in trying Chinese medicine for gallstones, for biliary colic. You do need to be aware of, like I said before, you do need to be aware of complications of gallstones, especially if you've had an episode of biliary colic. And if you do have complications at that point, most likely you would want to do surgery. But this is a good, I think Chinese medicine, acupuncture, herbal medicine are good options to also try to treat gallstones, especially if you're trying to, if you'd like to avoid surgery. So something to consider, but definitely talk to your doctor if you're interested in learning more about acupuncture and herbal medicine and what Chinese medicine may be able to do for your situation, whether it be gallstones or whether it be reflux or peptic ulcers or anything. Feel free to reach out to us. You can find our information at www.houstonacupuncture.com, and we would love to hear your story and help you in any way that we can possibly do so. So it's good talking to you guys again. Again, Dr. Cherian here from Houston Acupuncture and Primary Care, and we will see you next time on East Meets West podcast.